and welcome to Let's Get Personal, linking lifestyle and future appearance for high-impact patient engagement in health education. Thank you for joining us today. I'm Angie Yazelitis, and I'll be your moderator for today's session. I oversee marketing and business development for AprilAge, and am very excited to work with them on their public education efforts as well. Just a few housekeeping items before we get started. We will run today's presentation in a panelist question and answer format, and we will be opening up for additional questions at the end of the session. So please feel free to send over questions using the actual question feature in your GoToWebinar. We will also follow up with all registrants to provide you with some additional information regarding today's session. Lastly, this webinar is being recorded. We will provide the link in our follow-up so that you can share the information with other members of your team, or perhaps review areas that were most of interest to you. I do want to note that this webinar has been developed to fit the questions of the general audience. So if you are seeking more advanced usage information, please know that your presenters, Alex and Ron, will be making themselves available for some one-on-one sessions in the upcoming weeks. AprilAge develops the April visualization software, which shows someone how they will look as they age. April provides a high-impact engagement tool to complement health and lifestyle education across all healthcare venues. It effectively adds the effects of obesity, smoking, and heavy sun exposure to your naturally aging face. Its impact has been proven in independent controlled studies for inspiring change of risky lifestyle behaviors. April is currently used by hundreds of clients in more than 25 countries in health, science, aesthetics, law, and business. April is currently focused on inspiring new levels of patient engagement through the personal, motivational, and memorable effects of working with a person's own image to show the impact of lifestyle choices. As the Affordable Care Act focuses on patient-centered healthcare models, the demand for the technology and the expertise of the AprilAge team has grown. AprilAge is also very proud of their current client base and those usage models, which includes a focus on healthcare across all delivery models. You can see some of their current clients in both the insurance and the corporate marketplace, where they focus, as well as general health and science centers. Now, I'm very proud to present your expert speakers today, Alex Brown and Ron Estey. Alex Brown is the CEO and the co-founder of AprilAge. Alex comes from a broadcast and online background. She knows the power of images and the stories they tell. Her rich history as a senior executive and early employee in consumer technology, broadcasting, online, and social media, including both Facebook, eBay, assist her in understanding the role that IT plays in today's lifestyle. She also sits on the Leadership Advisory Council of the Perimeter Institute of Theoretical Physics, which is one of the world's leading teaching and research institutions in theoretical physics. Ron Estey is the Managing Director and co-founder of AprilAge. Ron has many years as an experienced executive, both starting and leading a number of technical and creative businesses. He is the creator of the April technology, which is the focus of today's webinar, and his experiences as an executive in both corporate finance and banking helps him to understand the role health and wellness plays in a corporate environment. Ron has also written about and helped develop government policy for visual effects organizations. As documented in the new imperative of patient engagement for hospitals and health systems, as public and private sector healthcare purchasers shift payment models towards value, and as demographic changes result in more chronically ill patients entering the healthcare system, these patient engagement efforts will become increasingly important to the financial sustainability and the clinical success of hospitals and health systems. AprilAge has both a tool and a model of best practices that can assist all players in today's healthcare model to support ongoing management and avoid more costly inpatient admissions. So with that in mind, during today's webinar, we will discuss the current health education engagement model, factors that lead to better engagement, along with the 4 key behavioral risk factors that lead to chronic disease. We will then introduce the April software as a best practice towards driving higher levels of patient engagement. Alex, visualization software is a very unique tool when used in patient engagement and health education delivery models. Can you kick today's session off by sharing some general thoughts about your software?
Thanks, Angie, and good afternoon, everyone. I'd be delighted to tell you about April. In a nutshell, what April does is it fast forwards through time to show someone their future fate. And it compares how you will age naturally to how you will age with the effects of things like smoking, obesity, and sun exposure. And it was originally developed with the Roswell Park Cancer Institute in Buffalo, who do a lot of work with smoking cessation. And working with them, we came up with the idea of a contrast and compare model that has the high impact of showing the very often dramatic, sometimes shocking effects that things like smoking and BMI increases and heavy sun exposure will have on appearance. And the reason it has this effect is because it is your image. And therefore, it's totally unique, it's totally personal, and obviously it's totally relevant to you as the individual. And as healthcare moves more and more to the personalization and customization, certainly we've seen this from our clients around the world when they tell us that this works like no other tool because it uses the greatest motivator ever created, and that's your own face.
It's interesting because we've talked about what's important in today's healthcare model is that patient engagement, that personalization. And according to a recent health policy brief, it said shared decision-making between providers, health plans, and patients is key. There are various modalities through which shared decision-making can be conducted. And I thought this was interesting. It said a typical process is to use those decision aids, leaflets, books, videos, websites, and other interactive media. And that gives patients information on the risks and benefits of various treatment options and help them make the choices that most reflect their personal values. Alex, can you share some insight into how AprilAge may fit into the shared decision model of patient engagement?
For sure. I mean, and you're right, Angie. We certainly know that information and education are great. But when people are actually inspired to change a behavior, there's required a motivational trigger that precedes their attempt to do so, like quitting smoking, for example. And there was an interesting study in the UK, an analysis of behavior change in a tobacco control program, and showed that motivation and triggers immediately precede a quit attempt. So quit attempts at smoking cessation, for example, can happen fleetingly. They can happen at random times. And so the trick here is to have tools available in all kinds of ways across all sorts of platforms so that people can access these tools. The tools have to be easy to access. And there's also been incredible research that talks about how visualization will be instantly and overwhelmingly more memorable if it's incorporated with an image of a human recognizable object, meaning certainly in April's case, your face. So it's not just an abstract visualization of charts and graphs. And the research says that once you've added a memorable human recognizable object, the motivation and trigger becomes absolutely more memorable. So if you think of, for example, if you have someone who is intended to quit, and they are in, for example, a retail pharmacy, and there is an exhibit there, or there is a nurse practitioner there who is running either a smoking cessation clinic or obesity counseling. What they can do is they can show the person through the April visualization tool exactly how they will look in the future. And the future visualization has a more memorable effect. And then they can follow that up with more traditional information and education materials and follow up in pamphlets, online help, webinars, things like that.
I think you really hit the nail on the head, because there's all these great tools, but if we're not driving people to the tools, then the impact doesn't happen, and certainly April does that. Furthermore, the Affordable Care Act, according to the healthcare blog, will fail without patient engagement. The question is, how do you drive patient engagement when current online tools and methods appear to have dismal interaction by the patients themselves? And I think that's so key to what we're saying. In fact, much research is being conducted to actually determine what motivates patients to get involved in their personal health care and lifestyle choices. And so you've kind of mentioned some of this, but one thought is to have models that motivate patients at the point of care. Alex, can you share a few brief thoughts on how April may fit into direct patient care or even into an online activation tool?
You're right, Angie. I mean, the Affordable Care Act expansion of access to care is going to continue to be a key driver of changes in the healthcare system. And increasingly, providers are being rewarded for better outcomes and greater efficiency rather than more volume. And so, therefore, the opportunities to partner in new and innovative ways can support the extension of primary care and higher quality at lower cost. I guess the question is, for example, if you're thinking of a wellness center or a retail health clinic or a health and wellness program, the question is, how do healthcare providers align their front-end offering to support this health and wellness transformation so that they can deliver an engaging experience for their customers? And the stats say that more and more it's about this personalization and customization. And for example, at a pharmacy level, there are efforts to align with integrated delivery systems to help pharmacies manage their customers by emphasizing joint efforts to improve medication adherence or support the management of complex patients, to create direct electronic medical record connectivity between the retail clinics and the doctor's office. And also they're planning to do more lab testing, and this is all in part to support the broader array of health advice from pharmacists. They want to become primary care offices and capable of caring for a range of chronic disease. But the question still remains, how do they align their front-end offering? And so when we talk about personalization and customization, if you can imagine yourself within a pharmacy, and you are there either because, for example, you need your flu shot this fall, and you've also been thinking about either quitting smoking if you're a smoker, losing some weight, or wearing sunscreen. And so if you can see something that speaks directly to you and has an immediate and impactful methodology to it, meaning showing you your own image, and then follow that up with relevant information. That is what we mean when we talk about aligning a front-end offering with personalization and customization to activate and engage patients.
And those possibilities are so exciting, and certainly even, seeing the visuals of other people. But I think probably what our audience wants to understand is what makes April different in terms of how the actual software works, how it's developed, and what makes it so effective.
Well, the April software is it's our proprietary database. It's unlike an artist rendition or a simple morphing technology. April's based on how real people age, and this is a point I really want to underscore. In the database, we have thousands of real people 3D head scans across 5 ethnic groups, male and female, ages 7 to 70, and our database is statistically significant in terms of being able to show you how you will age based on your gender and your ethnicity. So each cohort within the database can produce statistically significant aging results and showing you if you smoke or if you are obese or if you have heavy sun exposure. So that is why we have the clients that we do, because it is statistically driven. In other words, April is not a toy. It is used in healthcare and health and wellness settings. Certainly it's used for research as well around the world, and I know we're going to talk a little bit about that as well.
I think that's one of the things, is that what always excites me about the work I'm doing with AprilAge is the research that you've had conducted to help really validate the effectiveness of your tools. I know some of this is past research and some of it is ongoing. Alex, can you share some of this with us?
There was a fascinating study done that was published late last year in the Journal of Medical Internet Research. And it was actually conducted in pharmacies in Australia. And what they were doing, the researchers were exposing a control group to the April face aging software. And these were not pre-selected individuals. These were individuals who had randomly gone into a pharmacy to shop. And what they were exposed to the April face aging software in one group, and the other group was not exposed to the April face aging software. All the individuals were smokers, so we did know that they were all smokers. And the incredible stat that they found for those who had been exposed to the April face aging software was that there was a 13.8% quit rate of smokers who had seen their aged face, if you will. And importantly, this was verified by CO2 testing 6 months post-study. So they were engaged, they quit, and they adhered to their quitting. There was another interesting study published in the British Journal of Psychology and conducted with women. And it goes to what we were talking about, visualizing the future time perspective. And that's the ability to comprehend that one's current behaviors will affect his or her future self. Has been shown to be a determinant in the levels of smoking. Certainly some of the stats around obesity use as well, 72% in one study reported that seeing their future face greatly affected them. Some of the studies that are underway, it's really interesting to note that there's a huge interest now on using April to determine the damage to skin and see if this can help modify the incredible rates of increases in things like skin cancer, particularly melanoma. The U.S. Surgeon General released a report just last month talking about the great increase in skin cancer, with more than 5 million cases treated in the U.S. alone. So a number of the studies that you'll see there in the U.S. and in Europe are dealing with using April and how your skin will age once it's being affected by the sun.
One of the things I want to reiterate, because every time you talk about that research, particularly when you go back to the quit rate in terms of smoking cessation, having been in wellness for many years, I can tell you that I've been involved with groups that have looked at that quit rate and focused on a change in who's teaching, what tools they use, and it's very frustrating for them because they can't get above that, 1% range that you already spoke about. So it's, for me, I'm sure anybody in the audience that's been involved in something like that is going to look at that actual quit rate and be really motivated to find out more. Ron, I'm going to bring you in here for a minute. We've heard so much regarding the current models for patient engagement, how your software was developed. We've heard about the research behind it. I'd love for you to share a few case studies that show how your software is currently being used.
Certainly, Angie. Thank you very much. The most common application of the software is in a one-on-one situation with a facilitator and a laptop and the individual. And that one-on-one is certainly a very effective use of the software and very common. What I thought I would do is to show a couple of additional uses of the software that start to use some of our new technology in a different way. What you're seeing now is HealthWorks. HealthWorks is located in Tupelo, Mississippi, operated by the Healthcare Foundation of North Mississippi and the North Mississippi Health Services Hospital. The goal of HealthWorks is to improving overall health within the region. It's a community education and activity center whose mandate is strictly to present health messages in an entertaining and interactive way. For their use of April, they chose to create individual workstations for each of the three lifestyle factors that April tracks. And you're seeing on the screen here the smoking cessation station that has been produced. In the next room is the sun exposure, and the next room is the obesity model. Most of the participants that come through HealthWorks are families or school groups, and they use the self-serve stations by themselves. So this is a touch screen, uses a simple webcam in a fully automated environment. When completed, and this is really where the experience gets extended, is that they are able to print the results and take them home, put them on the fridge, and as a reminder of their experience and the message that HealthWorks is presenting to them of better health choices. The next example is a large installation that we created at the Ontario Science Centre. This is part of the Human Edge exhibit, and it's designed to overall show and explore the limits of human capabilities. Interestingly, this is the second exhibit that we created for the Ontario Science Centre. The first one did strictly aging, and the new version of the software that is created in this experience uses all three modules. And this is what we are seeing along most of the science centers and public exhibits that use the software. They're starting to build in the health aspects, the smoking, the BMI, and the sun. I think there's a change in the way that they think about what their mandates are in terms of using the software and bringing health messages to the people that come through their doors. The configuration that you can see is the configuration you can see uses a embedded touch screen on the left side, embedded in a desk. This enables users to look at the effects on the screen, enables other people, families, and people that are visiting with them to share the experience. And this again becomes a powerful tool to enable an interaction among the users. In this case as well, the takeaway is they can send the images that they create to themselves. Interestingly enough, it's such a popular exhibit that almost 2/3 of the total web traffic to the Science Center's website are people coming to get their images. And so certainly there is an engagement of people wanting to know what the future brings to their faces.
Thank you so much, Ron. That is so powerful, and it really gets me thinking creatively of all the ways that the tool can actually be used. So after looking at that, I'd like to pause just a moment and recap some of what we heard regarding the details of the April software before we get more hands-on with the software itself. There are some pretty significant reasons that show April software fits well into many models requiring patient or member engagement. And so you can start to think about something from insurance models, driving lifestyle change. You can think about actual provider models that need to achieve the better outcomes. that Alex spoke about. But the fact is, the reason that this tool works is because it's dramatic. What I mean by that is it gets immediate attention. Alex spoke so well on that. You know, our face is something we obviously relate to on a daily basis. And so it allows us to see, or it allows the software to show, and then it allows the software to connect to whatever that education might be. And in the cases that Ron spoke about, it certainly allows the folks to print that picture, which becomes even more memorable. It delivers a unique, personal, and very, very relevant way to engage patients and consumers in health education. The fact is, it is a powerful catalyst. Because it, as a catalyst, you know, you're suddenly motivated. And at that time, you can use that time to deliver additional information about chronic disease prevention and healthy living habits. So one of the examples I'll share is having been very involved in screenings of folks at health days in corporations. You see that something like cholesterol is a powerful catalyst as well. However, we don't see our cholesterol. So when you think creatively about adding this to that screening, boy, you can see how that would become even more powerful in terms of lasting effect. And then the fact is, it creates actionable buzz. What I mean by actionable is that you can actually see what would happen if you were to age naturally versus how you age based on your personal lifestyle choices. And let's face it, you are making those personal choices. So very, very powerful. Alex, we've heard a lot about your differentials at AprilAge, how clients are using April, and really the effectiveness of your research. Can you summarize for the audience how April really creates value?
I think if I would like the audience to take away the key points, it is to remember it's all about personal, customized way to deliver health messages and health education. And certainly it appeals to people's curiosity to see how they will look in the future. But what we've done is we've built that tool, built that curiosity, built that unique visualization capability that really only humans have in terms of being able to see into the future. And we've made an engaging tool that people can easily operate or can be worked on with a health provider or a payer or in a wellness program. And it's really, if you think of it like a front end to deliver follow-up messaging for related health issues and education and information. Certainly you could, if you were in a retail health environment, attach it also to the marketing of additional products, services, courses. And you can also use it as a catalyst for additional data collection and research. And this is what we're also seeing now with our current clients, is this is a way to understand, once they have people and people have been thinking about their future lifestyle and how are they going to get down that path for better future health. There is additional data collection that can be with the April software that's incredibly useful for follow-up for our clients with their patients and consumers so that they can specifically target individual needs in their delivery of personal health care.
Interesting. Ron, you shared the case studies with us. If I could pull you back into the discussion to go over some of the best practice ideas that you're seeing around the use of April. What are you seeing in the field? What are some creative ways to use or increase the use once somebody has moved forward with using April?
Yes, certainly the most prominent change that we're seeing right now with using software is to make it as easy to use as possible. And this, the advent of touchscreen technology really enables this to happen. Much easier. The high-end webcams that are now very cheap and very easy to use, again, enhance the ability to get people hands-on with the technology. So there's really no need anymore to use the software with a facilitator, although that certainly is one of the best use cases for the software as well, to use the software to engage one-on-one. What about me? What about my health? What about my future? Those kinds of discussions come out of using the software in a one-on-one environment. The new technology now, again, enables us to do things like have people print, email their images to themselves. That enables individuals who are facilitating health information to gather in email addresses and gather in areas of interest. Am I interested in smoking cessation? Am I interested in weight control? Those kinds of things are easily now captured, and we're seeing more and more of our clients starting to add those data gathering packages onto the software to enable it to be more than just a one-shot deal in terms of dealing with people, but provide a whole roadway of communications with users.
And Ron, I know you already mentioned this briefly, but the way that April integrates into different platforms is very important. Can you share some last-minute thoughts on this integration?
Certainly, the new versions of the software enable individuals to get at the software and use the software not just on a desktop computer as one was in the past, but the same kinds of technology can be used throughout the various platforms. Laptop, the kiosk, self-serve kiosks, mobile tablet. Certainly we're seeing lots of interest in mobile tablet and people being able to carry their images around with them, use the software, use the great new cameras that are coming onto mobile devices and tablet smartphones. And certainly website integration is again very popular. People can do it in the privacy of their own computer. And for a number of people, they really don't want to share this with anyone else. And so again, provides them the ability to do this in a more private setting.
And the possibilities really are endless. So I don't know about our audience, but I'm really ready to dig in and get a better understanding how April really works. Alex, I'm going to turn it over to you for the next few slides so you can tell us about April in action.
Thanks, Angie. And I'll just remind people that all the aging results are based on our statistical database of how real people age. So we're going to show you 3 samples and with the various lifestyle effects. So you will first see Jess, and this is Jess, and she's 19 in this picture. And then if we add the April-based aging effects, you'll see in the next slide, we've added the effect of natural aging compared to the effect of smoking. Again, we developed the smoking module with the Roswell Park Cancer Institute in Buffalo. And the value here, I think you'll quickly see, is it's in this contrast and compare. It's the stark reality of what happens when you smoke. This is based on smoking a pack a day. And so you can see the increased wrinkle patterns, the sallowing of the skin, the increased drooping of the skin as well. The next example that we're going to show you, this is Daniel, who's 32 when this photo was taken. And when we've aged Daniel, we've added the effect of obesity. And so Daniel at age 32 then aged to 70 as he would naturally if he didn't increase his body mass index. And then he is aged 70, and that's at a BMI level of 37. So aged to 70, exactly the same age, and you can see obviously how impactful this would be if you were running a program on nutrition and weight counseling.
Absolutely.
And then our last example, this is Ainsley, who was 9 when this photograph was taken. And we've added some exposure to Ainsley. And the reason we wanted to do it with a child was because the stats on smoking, on what the sun can do to skincare, particularly with young women, are really quite shocking. I mean, treatment for skin cancer costs $8.1 billion a year in the U.S. And, tan skin is damaged skin, and yet nearly 1 out of 3 young white women still engage in indoor tanning each year. And the same stat, 1 in 3 Americans report getting sunburn each year. And so the U.S. Surgeon General report really was a call to action to try and do something to prevent even getting tanned. There are about 400,000 cases of skin cancer each year, 6,000 of which are melanomas, which are estimated to be related to the indoor tanning. And so there are nearly 9,000 deaths each year because of melanoma. So the U.S. Surgeon General really got serious in this report and said, we have to, the key to helping people with better future health and reducing the cost of skin cancer is prevention.
That's so powerful. Every time I see these, it's amazing to me, the power of this tool. So we've given you a lot of information, and we are going to move into a question and answer portion of our session today. Before I do that, let me summarize by saying that AprilAge enabled software, as we've stated multiple times, is effective for several reasons. First and foremost, the fact that because our own face is memorable and motivating, when we see that aging process due to our own personal choice, we're more likely to change our behavior. That's backed by the fact that AprilAge research also proves that, and that those changes, quite frankly, prevent chronic disease and lower costs. And let's face it, that's the overall goal we're seeing in the United States in all aspects of healthcare today. So with that said, what I'm going to do is I'm going to move into the question and answer session, and I see I already have some questions. So again, let me just say that we will be answering any questions that we have time for. If we run out of time, we will certainly be personally in touch with you to answer your questions one-on-one. So if I don't get to your question, please don't think that we've forgotten you. So one of the questions that's actually coming in from the audience right now is, this is a great question. In the software, is there a way to turn off the BMI feature? In other words, to not have BMI as an option?
Yes. The software is totally configurable, so any of the options are able to be turned on or off with a simple configuration change.
Okay. One of the questions is, does the software run on a Mac?
The current version does not run on Apple products. Future versions will run on iPads and on iPhones. So that is in the works, yes.
Okay. Do you have to have, I think you addressed this, but this is a great question as well. Do you have to have a facilitator with the program?
No, not at all. In actual fact, in some cases, there are a couple of products. There is the laptop product, which is used with a mouse and a laptop screen and a keyboard. There have been cases where individuals, health practitioners, will just set it up in their office or in their health fair and let individuals use it by themselves. The training is not required, not very much required to understand how the software works. The new versions of the software, the Kiosk versions, are intended to be fully self-service, using touchscreens, using large icons, and so it's completely automatic, and so there's no necessity to require a facilitator. And it's a good environment for setup in a mall or in a pharmacy as a self-serve information booth. Certainly that facilitates those kinds of use.
That's excellent. Two questions here, kind of I'll do back to back. They kind of go together. One is, where is the data, which is PHI really, stored, and are you HIPAA compliant?
The data is stored. The client really determines where they would like the data stored. So the software is downloadable to the laptop or on the client server, and the data can be stored there. For an online version, it is stored. We have our servers on the Amazon cloud, and that is where the images are stored. So it's really up to the client in terms of where they would like it, what is the rigor in terms of their organization, what are they collecting any other data, which might be personal health information that requires them to store it on their own, within their own servers or on their own computers. So we're totally flexible in terms of that. In terms of being HIPAA compliant, when we work with covered entities, so providers or payers, we are always signing a business associate agreement, which states that we have the necessary protocols in place to work with covered entities to ensure the security of the personal health information.
I will add to that that the software is also configurable to delete any data on either on a periodic basis or after each aging, and so those options are there to actually delete the data and not retain it at all.
Okay. I'm going to ask this next question, as I think it's interesting. I know, Alex, you really spoke to this already, but I know when we first started working together, this was hard for me to really get as well. So it's, are the aging results accurate?
It's the question we are asked all the time. And what we have discovered with and developed with the database is, because it is a statistically driven process, and the aging results are based on an average of how, for example, a South Asian male ages. Those aging characteristics will be slightly different from how a Caucasian female will age. So the aging results are based on averages. And what the important thing to remember is that the aging results have to be believable. And that is what we have developed, and that's the tool that is in use in the marketplace, is that the aging results have to be believable. We're right now doing work to capture, obviously time plays a huge part of how we are able to determine how believable our aging results are. So we've started to track a certain number of people and take their images every year so that we can hold up their actual aging to the aging with the effects of April, and just continue to develop to make sure that we are as believable as possible. But we'll get comments all the time from customers and patients and clients who tell us how much they look like a relative of theirs, how much they can't believe they actually resemble someone in their family, or else it could be a parent with a child and they've had their child aged, and they can see the likeness within the family resemblance.
Interesting. I'm going to try to categorize some of these questions that are coming in, because there are some similar ones being asked. But one is on working with children and what, how you, I guess, would handle implementation usage for making sure that it's not being used with everything that's going on with bullying, or how you control for do no harm when children potentially have access to their own picture, and applying the BMI feature.
So what we've done is the site, according to the site usage policies and rules and regulations, you are only to use the tool, the April tool, in an individual setting if you are 13 or older. If you are under 13, then there must be applied consent from either your parent or your teacher, and that is if it's used in a school setting, for example, and that is a requirement of our rules and regulations. As Ron said, with respect to applying different lifestyle factors, you can choose to turn them on or off. You can also apply one at a time or two at a time if you so choose. So it is individually operable depending on what the environment is, what the situation is.
And I'm sure, you know, just as a backup to that, and my own comment is the user can apply, you know, whatever rules around the use of the software as well, or notifying parents in a school that it's being utilized. So certainly those procedures would be different, you know, depending on how it's being used. Okay, so a couple questions from some of your clients. One is, are there any big new features implemented in the last 2 years? I think they're been using the Kiosk version in 2 years. What would be the future?
Really the 2 or 3, I guess, major features that we are now developing is the ability to email from a kiosk or from the actual application. This is very popular, and it has been a really solid addition to the software. The other is touchscreen. Certainly, the touchscreen enables a much wider range of graphic capability. Adds a lot more speed to the process, just in terms of interaction. And we're always working on speed, so that's faster is better when we're building the software. We have just really brought out of the lab, I guess, in the last couple of weeks, software version of software that is running to 3 to 5 times faster than the previous version. So those are all new solid versions of the software. And again, the other thing is we did mention a little bit is cross-platform, the ability to use on iPads, on Android, on iPhones. All of those are either in the works or very close to release, or will be released within the next 6 to 8 months.
Excellent. With the max age, one of the questions is, can it be extended? Is it 72? What are your thoughts on that?
So the issue with range is strictly data. We are constantly adding data to the database, and we will our goal in the next, I really can't put a time on it, but our goal in the next short while, I guess, is to get that extended out to about 80. We find, though, that in fact, as our early research is that in terms of the characteristics that you get when you're early 70s, don't change measurably when you get to later ages. And so the aging characteristics and the damage has primarily been done by the time you reach 72. But certainly to extend more particularly, though, we are looking to extend various other categories, such as we're in discussions with an organization to do crystal meth modeling and alcohol consumption modeling as well. So likely we will see a broadening of the categories rather than extending of the age.
Interesting. That was one of the other questions, if you had other lifestyle effects. in the work. So I think you answered that. Would you want to add anything on that, or?
Nothing particularly. The ability to gather additional data is not trivial because we are, of course, not just taking individual pictures, but we are actually gathering a range of metadata that supports the granularity of those faces, and so the ability to create those additional categories is a bit of work, but certainly we're not shy of taking on additional work to improve the software.
One of the questions is, does it work backwards? Does it do reverse aging?
We're often asked this, and what I can say about that is we've been asked that enough that it is certainly something that we'll be talking about in the very near future. But rest assured, it is an incredibly popular request, and we'll be sharing some great news about that shortly.
Well, that's exciting. So who are the people who typically want to see themselves aged?
It's quite interesting to see kind of the social psychology aspects of the aging process. A lot of it has to do with the age range of people who want to see themselves aged. And I think it also has to do, you have to consider the context of the environment within when they're having this opportunity. So if you think, for example, in the Tupelo, Mississippi example, HealthWorks, that is for families and families with children, and so there is very much a focus. That entire experience is about bettering the health of the families and really educating people about that. So they're in it together, and kids are fantastic. They're fantastic with the touch screens. They're in it. They whiz through it. There's no hold barred when it comes to them seeing themselves aged. In a corporate environment or a health environment or a retail health setting, that's where you would more often have a facilitator who is going to be delivering additional health information, particularly if someone is intending to do something with whether it's lose weight or eat better or quit smoking or protect themselves from the sun. So that's where the encouragement, if you will, the encouragement of a facilitator is incredibly useful in terms of helping people through the aging process, because we've talked about the dramatic effects of seeing yourself age.
Interesting. Are you FDA certified?
Our analysis through the FDA is that, or the FDA analysis is that we're not required to be FDA certified because this is not a medical device. We've done an extensive analysis of the FDA requirements, and since we are not nor need to be classified as a medical device, then the FDA certification is not required.
Okay. I'm going to take one or two more questions here. This is always interesting. Is it used for missing kids?
Certainly. There are a number of cases where we have done agings for missing kids, quite popular, and there are a number of police organizations in Asia and in Europe that use the software that way.
Okay. And then let's just go to this last question, which is always a big one. How does implementation work? How do you price it? What kind of information can you provide on that?
The program, there are various versions of the software. The typical version we will download onto an individual computer, the user's computer. Very simple, one-click process to do that. The online version is available through our website. And that is accessible through any browser. The mobile version, not yet in the market, but very close, and that'll be available on the App Store.
Okay, wonderful. All right, so I think that wraps it up today. We want to thank you so much for attending today. We hope that it was both informative and motivating. As I mentioned earlier to you, we will be sending out the link for the recording and following up on any audience questions we didn't get to. And Alex and Ron, I just want to thank you so much for taking the time out of your busy day. Everybody enjoy the balance of your afternoon.
Thank you very much.
Thank you very much.